Okay, so for the first test, we go through the health history questionnaire. So I'm gonna ask Sydney here some questions. I already got her background information, like her gender, height, and weight, and then we'll see her risk stratification from that. So have you ever had a definite or suspected heart attack or stroke?
No.
Have you ever had coronary bypass surgery or any heart surgery?
No.
Do you have any cardiovascular or lung diseases?
No.
Do you have a history of diabetes, thyroid, kidney, or liver disease?
No.
Have you ever been told by a health professional that you have an abnormal EKG?
No.
Do you currently have any of the following? Pain or discomfort in the chest or surrounding areas when you
No.
engage in physical activity? Shortness of breath?
No.
Unexplained dizziness or fainting?
No.
Difficulty breathing at night?
No.
Swelling of ankles?
No.
Heart palpitations?
No.
Pain in the legs that causes you to stop walking?
No.
A heart murmur?
No.
All right. Are you pregnant, or is it likely that you could be pregnant at this
No.
time? Have you had surgery or been diagnosed with any diseases in the past 3 months?
No.
Have you had high blood cholesterol or abnormal lipids within the past 12 months, or taking medication to control your lipids?
No.
Do you smoke cigarettes, or have you quit within the past 6 months?
No.
Have your father or brothers had heart disease prior to age 55?
No.
Okay. Has your mother or sisters had heart disease?
No.
Okay. Within the past 12 months, has a health professional told you that you have high blood pressure?
No.
Currently, do you have high blood pressure? Within the past 12 months, have you taken medicines to control your blood pressure?
No.
Have you ever been told by a health professional that you have a fasting blood glucose greater than or equal to 110 milligrams per deciliter?
No.
Describe your regular physical activity or exercise program. Like, how often do you work out a week?
Probably about like 5 or 6 days a week.
Okay. And would you say the intensity is low, moderate, or high?
I'd say moderate.
Okay. And about how many minutes are those workout sessions?
30 minutes.
All right. Are you currently under any treatment for any blood clots?
No.
Do you have problems with bones, joints, or muscles that may be aggravated with exercise?
No.
Do you have back and neck problems?
No.
Have you ever been told that you should not exercise?
No.
Are you currently being treated for any other medical condition?
No.
Is there any conditions that may hinder your ability to exercise?
No.
During the past 6 months, have you experienced unexplained weight loss or weight gain?
No.
Okay. Are you taking any medications?
No.
All right. And then can you sign here?
Mm-hmm.
Thank you. All right. I'm going to sign it as the witness. And because you answered no to all of the risk factors, you are apparently healthy according to the risk stratification.
Okay. Excellent.
Okay, so Sydney has been resting here for 3 minutes, so I'm going to go ahead and take her heart rate on her radial artery location. So I'm going to start a timer for 30 seconds and measure the beats that I feel and multiply that by 2 to get her heart rate in beats per minute. Okay, so I got 28, so that'll be 56 beats per minute. Okay, now to measure her blood pressure, I'm gonna pump this up to about 150 because I expect that to be higher than what her systolic reading should be. So I'm gonna pump it up, release it slowly. The first sound I hear will be the systolic, and when the sound stops, that'll be the diastolic. Alright, so her systolic reading is 118 and the diastolic is 78. Alright, so now we're going to do the skin fold test, and with the values from these, you can find out a person's body composition. So with a female, the 3 sites you're going to measure are the triceps, the thigh, and the suprailiac. So first you want to measure to get the middle of, from like the acromion process to the elbow joint. Here. And then you want to pinch about 1 inch above where you're going to grab the caliper. And you want to do all the same side of the body when you do these. Alright, so 16. I'm going to do the thigh. 19. And then the suprailiac here. And this one's a diagonal measure. 15. Alright, and then you would repeat that 3 times and take the averages from those. Alright, so for the flexibility or the trunk flexion test, we've set up a makeshift sit and reach box here. The only thing that's different is there's nothing that are keeping her feet flat, but she's just going to try her best to not point her toes. If we're in the lab setting, we'd be using the sit and reach box. So what she's going to do is she's going to have her fingers together, I forgot to tell you that last time, and not put one hand in front of the other, anything like that. And she's going to reach her farthest and hold it for 2 to 3 seconds, and she's going to repeat that 3 times. And we're going to see what the best value out of those 3 times is. So you can start. All right, 17. 17. And 18. All right. Okay, so for this partial curl up test, I've taped 10 centimeters from Sydney's fingertips, and when she curls up, she's going to lift with her abs, slide her fingers forward until she feels the tape. And she's going to do this to the beat of a metronome set to 40 beats per minute. And she's going to do that as many times she can or until she reaches 75. So I'll be counting for her. So I'm going to start the metronome. Okay, you can go up, down. That's 1. Alright, so she was able to do 75, so that's great. She did awesome and reached the max for the test. So for this push-up test, Sydney is, since she's a woman, she's gonna be using her knees as her pivot point. So her starting position is actually gonna be in the down position. You can like lower yourself, like, yeah, like how you were, but then just like you can lay down pretty much. Yeah, that's good. You don't need to like hold yourself up. Okay. So her arms are at a 90-degree angle, that's great. She's again going to use her knees as the pivot point. She's going to keep her head up, her back straight, and do as many as she can like this until she can't anymore. Alright, so you can start. And then touch your chin. 1, 2, 3. And try to keep your lower legs on the floor. You're good. 4, 5, 6. 10. Alright, so this is the Queens College step test, and this is one of the ways that you can calculate your VO2 max. So what we're going to do is set the metronome to 88 beats per minute. I have that here, and then on every beat, she's going to be taking a step. So it'll be up, up, down, down on the beats. And like I said, she'll be doing that for 3 minutes, and then she'll rest for 10 seconds, and I'll take her recovery heart rate. Okay, so you can start stepping to the beat. Okay, so it's been 10 seconds since she completed her steps. I'm going to take her heart rate at the radial site for 30 seconds. I'm going to count the beats and then multiply that by 2 for the beats per minute. So start the timer. Alright, so I counted 82 beats and that'll be 164 beats per minute. Another way you can calculate someone's VO2 max or more estimate it is using the non-exercise VO2 max equation. So what information you need for that is the height of the person in the centimeters and their weight in kilograms. You also need to know their level of training. So I use the untrained female because Sydney's not an athlete. She works out from time to time. So I input those into this equation here, and I got 46.8 for her VO2 max. A third way that you could estimate the VO2 max is the Rhodes walk test, and with that you have your subject walk a mile as fast as they can without running, and the two parameters you would take from that to plug into equation would be the time that it takes them to walk that mile as fast as they can, as well as their heart rate at the end of the mile. So Sydney is overall a really healthy individual. She had great results for most of the tests. The two that were lacking or just had a little bit less than a desirable result would be in the flexibility and the upper body strength or push-up test. So what I would recommend to work on those things is for the upper body resistance and strength training. So a lot of weights that focus on activating your triceps, your biceps, and a little bit of the muscles in your back and shoulders. So your rotator cuff, your trapezius, deltoid. And then for the flexibility test, I would recommend a lot of dynamic and static stretching and kind of build it into routine and do 4 to 5 days a week. Just take a good chunk of your workout time to really focus on stretching those hamstring muscles, your low back muscles, and your hip flexors. One thing I did forget to mention was her BMI. So calculated from her weight and her height, her BMI was 22.7, and that's considered a healthy BMI. She's not underweight or obese or anything like that. So yeah, overall she's a pretty healthy individual.